Hi, can a raw diet heal MS? Can you? There's nothing you can't. Let's put it that way. There's nothing you can't. And with that kind of attitude, there's nothing you can't. I've never seen anything the body couldn't regenerate. Yes, I've had the medical doctor people take people down so low, I could not get them back. You get that MS out of you, dear one, and get on the raw and get going. Get up upper circuit brain and nerve. If you have any brain lesions, get your lymph moving, get your bowels cleaned up, get your adrenals turned on, and you will go forth MS free. I've never seen an MS client that couldn't get up and walk again. And if you're an MS, you don't let anything stop you. And you've got to learn the lymph system and the acid side of chemistry and why you get brain lesions and all that, and how you simply get all those acids out of the body and rebuild these lesions and get anything like that, rebuild the myelin sheaths. That's all a given. But you can't do that level of work on vegetables. I just flatly will tell you straight out. I've said this before. You cannot rebuild neurologically in a human with vegetable matter. It requires fruits and berries. Well, you just keep empowering the adrenals, upper circ, brain and nerve. You get on the right herbs, and she's going to get this out of there. She's got brain lesions. You know you got to move that lymph. Clean that gut up, get in the head, clean that out, upper circ, brain and nerve. Get those brain lesions healed up out of there, especially in the cerebellum. You drain this whole thing. You get the adrenals up, and she'll be walking. I'm hoping that your girl is going so gangbusters that she won't even see a residual kick. Possible. Now remember, in all healing crisis, she could have her MS symptoms back. Probably won't happen toward the end before she walks, but they could come back. Don't freak out, plow through, because you remember you notice symptoms twice, when you first create them and when you're eliminating them. MS. All right, here's some setups for MS. Cerebellum weakness. Adrenals, hands down, chronic, where your blood pressures are low, chronic fatigue syndromes. You have nerve rings to where your myelin sheaths are weak. You have a lot of lymph backed up in here from chronic bowels. So now what you're getting is brain lesions, inflammation, or the breakdown of the cerebellum. It's the equilibrium vertigo side of this. The recharging unit for the nervous system. The adrenal glands are down, can't keep a charge up. The myelin sheaths are down, you can't keep charged up. So then you have little spurts of energy and you have to rest. You can only have so much, and after a while it puts you down into a chair, you start dragging your feet, things like this. So this is, MS is full bore. Remember, I've said this many times, and I've talked about neurological conditions many times, but MS is full bore fruits and berries and melons and nothing else, in my humble opinion. Nothing else, not even a vegetable one. Fruits, berries, and melons. And you've got to get to the gut, you've got to get to the kidneys, you've got to get to the adrenals. I use adrenal 400s and in terms of glandulars, and I'm up in upper circuit, brain and nerve. I'm getting that lymph out so I can rebuild brain lesions. I'm in, actively inspiring the whole body to function and eliminate. Because if you look at this, it's obviously an elimination problem because it's so acidic. You're burning in multiple places. You're seeing the breakdown of central and autonomic tissue and the inability to recharge that tissue. You have to change the nature of the chemistry interstitially, and that's called hydration interstitially, and that takes a little while to do that. We've got to get past this idea that we have to stick, that's the mind, we have to stick a name and call it a disease. We just got to get past that sort of thinking, because you don't have to label it. She's got a neurological condition that's bringing her down. And it's either autonomic or central or both. Just remember, there's two nervous systems. Well, you're going to go after both of them the same, except to get upstairs to the central, you're going to use upper circuit, brain and nerve. The brain and nerve formula will also strengthen the autonomic. The autonomic, you're going to go right back to the adrenal glands. You're going to get the kidneys filtering, get the adrenal glands up, producing better neurotransmitters. But at the same time, you're going to open up the pathways of better nerve flow, because what can reduce pathways of nerve flow is the lymphatic system expanding and swelling. Yeah, you get tight, stiff shoulders, numb hands, same thing. You can shut down neural flow with lymphatic swelling. This is what happens in the brain. And then you get glaucoma and you get all this pressure and all this stuff, and it all goes. Because if you don't remove acidosis, you can't remove degeneration and the degrading of the condition of the cells. We change that, hydrate, and turn it around, and things will rebuild. But don't live in the world that I'm only going to go downhill, because that's not true. And I would start immediately, get her on all raw, and move up to the fruits, berries, and melons when I can, get her on a good herbal program, but remember upper circuit, brain, and nerve. Get her kidneys filtered and get her detoxed. Get her bowels cleaned out, and you'll turn her totally around, bet you $100. You got to regenerate. You got to get to the core. You got to get to the cells. And the neurological system in man is the most difficult to regenerate, no question. But you have to understand physics and magnetics and the importance and difference between the magnetic level of fruits and even those of vegetables. I wouldn't even worry with vegetables right now. I mean, if you're so worried about weight, maybe put a green drink or two. But boy, I wouldn't worry about weight right now. If you have to, we can put some superfood blend down you and some other things. But you really got to move those lymphs. And this is, you're in a catch-22 right now. And so you can work yourself out of this. I'm going to put a positive note on you and give you some hope, because I've seen people do this. I can't stand to see people suffering. It's kind of like this blood sugar. Here, you got MS, take these chemicals and we'll just let you suffer the rest of your life, because they don't know any better. We know better. We're the healers of the planet. We know better. So as healers, we're going to go after these people that are suffering with MS. Any neurological condition is suffering. Get on that raw. And whether you have brain lesions or not, upper circuit, brain, and nerve. You really want to get into that lymph totally, as we've discussed previously, and how do you get your lymph system moving. Don't sit around. Even if you don't have, if you have minor MS symptoms, don't wait. Don't wait until you can't walk like this poor lady. And we have a ton of them coming in here, wheelchairs, canes, or on stretchers. So you don't have to go that far. The further you take your body down, the harder it is to get back. So, you know, don't go down too far. You really want to hit on this and go into this raw and this higher level of fruitarianism if you want to get out of that MS condition. Yeah, she's in Lithuania right now fighting her parents over that. Can you believe that? When you see someone getting up from a chair walking, wouldn't you go, wow, I'm going to eat that way too? Oh, no. No. Oh, you should be eating meat. Yeah, when I wasn't walking, Dad. Get that lymph moving. Get up high on the fruit. Greatest nerve regeneration there is in the fruit level. A lot of MS out there. We got to stop this. A lot of brain lesions out there. Very curable. But what breaks down tissue? Acids. And that's what you got to get. It's the acids. You know, the irony of this whole thing is that we actually die on our own waste. What an internal joke. Woo. You know, whenever you see the Parkinson's, the MS, or the Lou Gehrig's, you know, number one, adrenals are involved. Number two, cerebellum, most cases are involved. Number three, other parts of CNS, you could have many brain lesions up there. 4, you know your adrenals, kidneys all tie into the lymph system. You know it's acids breaking down your lymph system. You are breaking down your nervous systems, breaking down the rest of your body. You know that. So you know those are the 4 things you always see in that. So whatever things you saw in your life while you were building to that, you could see from all types of inflammation and all types of things, ovarian cysts, uterine fibroids, fibrocystic breast, fibromyalgia, all these things, lupus, Lyme's, all the arthritises, all these things. These are just fancy names for acidosis in specific locations and cofactors to that. Doesn't matter what the cofactors are, because you're going to fix the main factor of this. But a simple process, but it does take work. But I tell you, it is simplicity that will pull you out of this, but it is a lot of hard work and effort that will help you gain your freedom again and your reality again. So just hang in there and keep working that. MS, you will always find these factors: cerebellum, adrenals. Once in a while, you'll find an MS without brain lesions, but I can tell you most of them do have brain lesions. which you can look at that any way you want, but that's acids on the brain. Of course, the cerebellum, where the parasympathetic comes in here, is going to be involved. You're going to see equilibrium and vertigo, inability to walk properly. You're going to see lower back. You're going to see kidney and the adrenals, which is the neurotransmitters for the autonomic. You can see GI tract and stomach problems on top of that. If this is all impacted with the lymph that's this way, you could see pituitary and thyroid problems. Absolutely. So the first thing with a neurological problem is start working yourself to where Brianna is, fruitarian. You work yourself up to a fruitarian. Fruit and berries and melons. The highest energetic, nutritive foods that nature provides. Those are the nerve rebuilders. Those are the nerve exciters. Those are also the nerve calmers. They're not only anti-inflammatory, meaning antacid, they're antispasmodic as well because of the same way. So they go a long way to help that. So when you have an MS case, the first thing I would do is put them on an antispasmodic. And that will help with the tremors. It'll help with any type of pain in the body. You're going right into their kidneys, right into their adrenal glands, and you're going to work it because the chances of them having low blood pressure is a big deal. And they're going to see it anyway as they fix their kidneys. You're going into their lymph system and fix that. And you're going to also get into their GI tract and fix that so they can start draining their sinuses and cleaning their head out. And really start moving this lymph out. So protocols would be simple. Stomach and bowel formula, take care of the GI tract. A lymphatic capsule, that'll also take care of the GI tract, but it'll also become systemic. That'll start moving and astringing the lymph system. Start pulling on these acids. You're going into 2 kidney formulas to start inspiring the filtration of the kidneys. You're definitely going to hit the adrenals to inspire the kidneys to function since they sit on top and control the kidneys. You also want to bring more neurotransmitters forth to excite the myelin sheaths and turn back on the autonomic system again. You want to drain the sinuses, so you want to work them toward a cold and flu-like symptom. If they're cold, you want to get the thyroid up to get them to have a fever. I definitely love upper circuit brain and nerve. Would be something I'd be on constantly with this problem. Definitely. You can use glandulars with this problem to help. You want to check the pituitary, check the thyroid, basal temperatures, see how that's working. Make sure they're utilizing calcium. Make sure they don't have any varicose veins or spider veins. Their fingernails are strong. They don't have petechia or bruising easy. They don't have what you would call calcium-related problems, depression, and things like this. If they are, you go right into that parathyroid and start bringing that up because they need to utilize calcium. Calcium is a main component also in nerve function. When that's down, so is the nervous system. So these are the areas. Very simple. The problem with neurological conditions, vegetables are not good. I have a lot of experience when it comes to neurological events, and this is where the fruits and the berries excel by far. Try it, work a case and see what it's like. Get you an MS case and work that case for a couple of months, watch the improvement, then put them on vegetables and watch the differences. It's just a big difference. It's been in my face for years. We were talking to an MS case yesterday, and this is a broad span. You can lump a lot of neurologicals in this, from Lou Gehrig's to MS to even maybe Parkinson's, all in this broad span. You've got brain lesions and you don't. Brain lesions can be any kind, frontal, anywhere. A brain lesion can start out as a genetic weakness in tissue and then exacerbated with acidosis, where the acids just break down these tissues. These are not difficult to regenerate, but you have to first understand that what breaks things down is the acids of the world. Acids are corrosive, and your body produces acids as 1, cellular byproducts, 2, parasitic byproducts. We just talked about uric acid and the byproduct of fungus, the fungal community. So there is a lot of acids produced internally. Just moving your muscles creates uric acid or lactic acid. So you have a lot of acids, phosphoric acids, carbonic acid. There's just a lot of acids that are created that are not all converted back to base, but must be eliminated out of the body. You can't run acids in the blood, so you know you have to have a distinct separate system. So when the lymph system backs up in the brain, it can affect the cerebellum. When the cerebellum's involved in a neurological case, you see the equilibrium problems, the dizziness, the equilibrium, the vertigo problems. It can also connect it to the to other parts of the brain, but cerebellum is oftentimes involved. Oh, whoa, I have MS, multiple sclerosis. I use forearm crutches to walk. 100% raw fruits, berries, and melons for you, Susie, and nothing below that. Now, don't do anything below that, sweetheart. You get yourself moving. I would do upper circ, brain, and nerve. If you have any brain lesions, get your bowels cleaned up, get this draining. Use those neurolymphatic points down your back to get this cerebellum drained. You want to get those adrenals up. I would use the adrenal 400s if it was me. 1 or 2, 3 times a day. You want to get that blood pressure up to about 120 because I'm sure you got low blood pressure. And so you want to fix that, get the kidneys filtering, and get that nervous system myelin sheaths rebuilt. Very, very important. I take an oral drug for fatigue. Glandular. Hit the glandular for the adrenals. 400. 1, 2, 3, 4 times a day, 3 times a day. I don't care. Start with 1, 3 times a day. If you have to go up to 2, go up to 2. You're adrenally exhausted. You're not holding. You're not charging those batteries, the myelin sheaths. And by the way, got to get this drained lymphatically. Cold compresses to the cerebellum here. That's your equilibrium dizzy center. It's also the parasympathetic into the autonomic. See, I have lupus, MS, Sjogren's, fibromyalgia, to name a few. You have an autoimmune problem, and there's just absolutely nothing that's out there for you. Boy, how would you like to hear a video like that? What's wrong with this case, guys? Help me out here. We got a blood problem here? No. What kind of problem do we got here? We got a lymphatic problem. You're systemically backed up. You're feeling it all through you, honey. So you really got to move your lymph. See if you have any orange in your eye because, you know, cases like yours generally have a lot of sulfur in there, which gives a lot of fungus, which exacerbates the acids, of course, with the uric acid and all the other acids. But then it also just makes the lymph system even more sluggish. You'll find in RA cases a lot of those high sulfur cases. This locks your lymph right in there. So go down that line what we're talking about. Hit your kidneys, hit your adrenals, hit the lymph system and clean all these acids out. And funny, all this lupus, all this fibromyalgia, all the MS will disappear. If not, you'll be trapped in this autoimmune syndrome ridiculousness and suffer the rest of your life. That's crazy. No, you don't anybody accept what they have. Don't accept it. Make your body come back and you win, okay? You will.